everyone. I see that it is exactly 12 o'clock, so we're going to get started here. So good afternoon. My name is Morgan Feely. Welcome to our Lunch and Learn on the 5 summer health hazards and how to avoid them. Today with me is Dr. Gina Glass, the physician at the Triad Health Center. If you have not been to Health Center before, we are a comprehensive primary care doctor's office. We offer convenient access to Dr. Glass both in person and virtually for the majority of your health needs. For the virtual appointments, you would just need to download our Spruce mobile app. So before I turn things over to Dr. Glass to get started, we'll have a few moments possibly at the end for some questions. You could put them right in the chat box throughout the presentation. If there comes a time that we won't get to all of them, I do have an email address at the end where you can send them directly to us and we'll get you the answers to your questions. So with that being said, I will turn things over to Dr. Glass.
Thanks, Morgan, and thanks to all of you for joining us today. I just noticed while Morgan was talking that my little box actually says I'm Morgan, so I don't know if you guys see that too, but I'm Dr. Glass, and Morgan is not Annie, so sorry about that. We were just thinking that today, I'm Dr. Glass, as you see on the slide. I'm the physician at the Triad Health Center, in case any of you haven't had a chance to come down or for us to talk or meet yet. But we thought that this month's event, health hazards and tips to avoid them. Since the weather's getting warmer, summer's essentially started, the unofficial start of summer anyway. And we know people are trying to get outdoors more, especially as COVID restrictions are loosening, to really try to enjoy ourselves a little bit more. So we want you to do that, but we also want you to be safe and to know how to handle some of the common things that come up. So let's go ahead and go to the next slide to talk about the first topic we were going to discuss today. So dehydration is the first topic that's going to lead into some of the other things we discussed. But, as I'm sure you know, we all sweat more when we're out in the heat, and this is really our body's way of trying to help us cool down, because our body uses the evaporation of this sweat to cool our body temperature and keep us at that 98.6 body temperature. But of course, when we do this, we're going to lose more fluids. And so as the slide says here, if we're waiting until we're thirsty to try to hydrate, then we're really getting behind because once we feel thirsty, we're already partially dehydrated. That's our body's signal to us to let us know that it's experienced dehydration. So we need to be really proactive about hydrating. And I wanted to point out that alcoholic beverages and caffeinated beverages really don't help in this regard. They are going to make us lose more fluids and actually lead us to be at higher risk for some of the consequences of extreme heat and dehydration. So we're just going to go ahead and go to the next slide to talk about some of those aspects as well. And then we'll talk about kind of preventing all of them together. So heat exhaustion and heat stroke are two heat-related illnesses that are unfortunately, fairly common, especially the heat exhaustion. So I already mentioned that our body's way of trying to cool down naturally is by sweating and having that sweat evaporate off our skin. But if you're in the heat for an extended period of time, especially if you're not keeping up with your fluids, your body may have difficulty producing enough sweat in order to cool down effectively. Something else that can really be a factor is if the humidity is very high. I know weather forecasters will often talk about a heat index, which takes into consideration this humidity, because in high humidity, even if we're able to make sweat, we can't evaporate it because the air is already so saturated, I should say, with water that the evaporation is not going to really happen and effectively cool us down. So talking about early signs of heat exhaustion, hopefully we can prevent it altogether. But if you're starting to have some early signs, such as muscle cramps, headache, nausea, dizziness, fatigue, or noticing a rapid heartbeat that we wouldn't expect, if we're not like really doing a lot of cardio, we really need to pay close attention to that in order to prevent the next consequence, which is very, very serious heat stroke. So if we're noticing any of these symptoms, in addition to drinking lots of water, we really want to get ourselves out of the heat, into the air conditioning, or at least a shady location, maybe even applying some wet cloths that are cool to our forehead or parts of our body to try to cool us down. If though you start vomiting or the symptoms don't start to improve within 30 to 60 minutes pretty quickly, then you definitely need to seek medical attention. Because as I mentioned, heat stroke is a medical emergency. If you are progressing to that stage, you really need to call 911, get to the hospital so that in-hospital cooling methods can be instituted. So just to, as an aside, sometimes people wonder, what exactly, is heat stroke or how that's different from the rest of it. In heat stroke, our body temperature actually rises because we're no longer able to cool down effectively. And the aside I was actually going to say is that if you're having a fever from an illness, then that temperature is not really harmful to us in of itself. If your body's producing a fever to help fight off an infection, that's not harmful. The underlying illness could be, but the fever itself is not. Conversely, with heat stroke, it is very harmful to us. It really causes organ damage and even death. So it's extremely important that we try to prevent it and recognize the early symptoms. So now that I beat that into the ground, probably, let's go ahead and go to the next slide to talk a little bit about tips to avoiding all of this to start with. So to avoid the dehydration as well as the consequences, dressing appropriately means wearing things that are going to help us stay cool and not absorb so much of the heat. So that's light colored clothing, preferably loose fitting, so that your body, the sweat can be evaporated more easily, and also things that are going to block the sun, such as a wide brimmed hat, as we can kind of get a glimpse of in this picture. So all of these things can certainly help. What's even more important is to try to do outdoor activities during cooler hours. So on hot days, you really want to make sure you're trying to avoid that midday time, maybe early morning, late evening, to do activities, especially if you're going to be exerting yourself. Already talked about hydrating proactively, not waiting until you're thirsty. Specifically, it's recommended to drink at least 8 ounces of fluids every 15 to 20 minutes. And as I mentioned, those are non-alcoholic, non-caffeinated fluids such as water, or, if you're really, really sweating a lot, maybe some of the electrolyte fluids, such as things like sports drinks, might be helpful as well. And then pacing yourself is important. Those of us who work indoors in air conditioning, we're just not acclimated to the heat. So people who work outdoors all the time and get more used to the heat, after a few weeks, they do gradually acclimate to some extent. But if you're just going out because you're on vacation or on the weekend and out in the heat for a long time, you're going to have the consequences much more readily than people who are used to it. So it's important to pace yourself, take frequent breaks, get out of the heat. So that was kind of a quick overview of that. We're going to move on to another topic, but let's go ahead and do a polling question to kind of introduce that next topic. So the polling question is, when should you begin to worry about your sunburn? So we gave you a few images here. We have image 1, image 2, or image 3. And I believe a question should pop up for you to, there you go, to put in what you think. Which picture do you think is reflective of time you should start worrying about your sunburn? Just give you a minute to do that, just to kind of open the conversation a little bit there. Okay, great. So, these are different stages of sunburn, and I'm glad to see that most of you actually picked image 2, which some people might think is, oh, that's just a mild sunburn, nothing to worry about. But as we're going to talk about, even a mild sunburn is something that causes damage. And I'm losing my background there. I forgot to tell that I decided to use Zoom technology to bring me to a sunnier location, but you got to glimpse behind the curtain there. So let's go ahead and go to the next slide. To talk a little bit about sunburn. So As I pointed out when you picked image 2 there, that every burn is a sign of injury, excuse me, I can't seem to talk today, to your skin that can result in premature aging and also increase your risk of skin cancer. So let's just back up for a minute, because not just sunburns, but even suntans, do definitely cause some damage. Many of us think that suntans look good and look healthy. I know it's, something that people sort of strive for a lot of times. But what a suntan really is your body trying to prevent the damage that sun causes from the UV radiation, and it produces melanin, this pigment, to try to absorb some of the harmful rays. But some of the rays are still going to get through. It's not, your body's not able to absorb all the rays, even if you don't get a burn. And in those cases, really the biggest risk are the things of premature aging, wrinkles, sunspots, kind of thickening of your skin. All of those things happen with even suntans. What really increases your risk significantly of cancer, though, is when you get to the point of a sunburn. Excessive sun tanning increases your risk too, but once you get a burn, now you've really done significant damage. It's basically an inflammatory response from the UV radiation that got through because your body just can't absorb all of the rays. So even the mild ones can cause harm, and it's important to prevent those. Before we get into prevention, I just want to talk about some tips for management, because despite our best efforts, I'm sure we've all had a sunburn at some point, and we'll try to prevent as many as possible, but likely to have a sunburn again at some point. So because it's an inflammatory reaction, things like ibuprofen, generic Advil and Motrin can be really helpful to manage the pain, the redness, the swelling. So that's one thing to consider. Also, because it's inflammatory, like topical anti-inflammatory, such as 1% hydrocortisone cream can help, particularly if it's in a limited area, you can apply that. Other things that might help you with the symptoms is applying like cool compresses again, maybe taking cool baths and showers to help you manage the symptoms. Definitely want to keep your skin moisturized when you have a burn. So applying a gentle moisturizer right after you bathe or shower is a great idea. Something else you could do is while you're still wet in the shower, you could get like an unscented baby oil and apply that all over while you're still wet. And then when you blot dry, you're no longer greasy, but it really helps trap that moisture in. Those are also great tips if you have like dry skin or eczema as well. Aloe vera is something that people really find helps them, and that's definitely safe to use, and it can be like a cooling gel as well. There's no magic about aloe vera in particular, but it can help you manage your symptoms. But really just being gentle with your skin. You've got a burn, you need to use very gentle soaps, gentle products, and most importantly, stay out of the sun, cover up completely until it heals. It's really tempting, I know, if you peel or you blister to try to peel those off, but you want to allow that to come off on its own, because that's your body's natural way of having a protective barrier while the skin underneath is trying to heal. Still drinking plenty of fluids, because you are going to evaporate more when you've got a sunburn. And then just quickly mention too, if you have a really severe sunburn with a lot of blistering, or if you're having any symptoms such as a fever or nausea as a result of the sunburn, definitely want to seek medical attention. You want to talk with your doctor. You're welcome to call me to see what else can be done, to better manage this. So let's turn the next slide to again talk about prevention, because obviously if we can prevent it, that's even better. So similar to avoiding the heat-related illnesses, we want to try to avoid those peak hours of sunlight, like 10 a.m. to 2 p.m. It's going to be the hottest time of the day too, but also we want to just try to avoid it if possible, even on cloudy days. You may already know this, but UV rays definitely come through even when it's cloudy. Of course, some of us are still going to be going out, even on the off hours, you want to apply sunscreen, but definitely if you're going during peak hours, really important to be applying sunscreen. You want to start with a broad spectrum that covers UVA and UVB rays, and then have an SPF of at least 30, and that refers to the UVB protection. We'll talk more about that in a minute. Water resistant is best, so that it comes off less easily, but even with water-resistant sunscreen, you need to reapply, and that's probably the most important thing to get out of this, is that you need to really be reapplying at least every 2 hours, and if you are swimming or sweating a lot, even sooner than that, because even though it's water-resistant, it's still going to come off. So that's the thing with SPF. Theoretically, SPF means that if you have an SPF of 30, that you can stay in the sun 30 times as long before getting burned than if you don't have any sunscreen on. But that's not exactly true because of the fact that it wears off. We want you to have that broader, spectrum or the higher SPF, but you're not going to get 30 times as long because of it wearing off. So you really, really need to be reapplying. I will say that there are some really high SPFs out there now that once you get past 50, the benefit really plateaus. So there's probably no increased benefit to something higher than between 30 and 50. Whatever product you like is fine. It's not going to hurt you, but you don't really have to go to the super high ones. And then finally, if you need something stronger, what you do need to do is sun protective clothing, because even with sunscreen, again, some of the rays are going to come through. And so if you need to protect your skin more than that, the higher SPF might not help, but wearing a broad rimmed hat, even long sleeve shirts and pants, they have some really nice ones that are meant for the sun, can be really, really helpful. So let's shift gears because we have a couple other topics we want to cover. And then if you have further questions, you can let us know. Let's go ahead to the next slide. And we're going to talk about ticks. Of course, in the summer, there are a lot of insects that are out there that can be bothersome and can bite, but I wanted to focus on ticks because we have limited time, and this seems to be the one that I get the most questions about, possible bites and what to do and what to worry about. So it is important that we try to avoid ticks, and we'll talk about some tips for that, but I wanted to make sure you realize that although ticks can transmit diseases such as Lyme disease, so this is why we get worried about them, that only happens if they've been attached for at least 36 hours, maybe even 48 hours, and the longer they're attached, basically, the higher the risk. So if you have a tick that you get off within 36 hours, you really don't need to worry about the transmission of disease. You do want to get them off still as soon as possible, and you don't always know the exact time, of course, that they attach, but sometimes you can tell by when you were outside or likely to have been exposed. Now, if you do have a tick that's attached, you want to make sure you remove it correctly as well. So it's important that you grab it. I do have some tweezers, like some really fine tip tweezers, if you can see these. You want to grab it very carefully right at the skin, so that, if you can see my hand, right at the skin, so that you get kind of right at the head. And then you're just going to put gentle traction on it, pulling steady, but gently, firmly, firmly and gently, if that's possible, so that you're not ripping it off, basically. If you twist, if you jerk, then it's likely to break up and the head and some of the body parts may remain attached. If that happens, try to go back and get the rest out. If you can't get it out, definitely, seek medical attention so that we or someone else can remove the rest of it for you. Now, if you think it has been on for 36 hours or more, you also want to contact us or an outside health provider to discuss whether you should be given a one-dose antibiotic to try to prevent Lyme disease. So, I'm not saying everybody needs that, but it's worth having a discussion because there is a one-time dose that can be helpful to prevent Lyme disease if you take it within 72 hours of removing the tick. So it's been attached for more than 36 hours and you can take the dose within 72 hours of removal. That can be helpful for some people, so worth talking with somebody about. The other thing I wanted to talk about was what kind of rash to worry about, because a lot of people will contact me and say that they have a red area around a tick bite, or they were worried they had a tick bite. And it's common to get a local reaction pretty soon after the tick bite that's not actually worrisome. It's similar to the reaction we get from like a mosquito bite or some other insect bite. So if you get a red area that happens right away, that stays like 1 to 2 inches at most in diameter and isn't continuing to expand, that's not the kind of rash that we worry about. That's a local reaction. You can treat it like any other insect bite with like a steroid cream or other kind of lotion that you might use for the itching. However, if you get a red area around a tick bite or where you might have had a tick bite that occurs later, it can happen as early as 3 days after a tick bite. More commonly, about a week or a week and a half after the tick bite, it'll occur, and it can happen up to 30 days. That could be a rash from Lyme disease. We call it erythema migrans. It's a fancy name that basically means that you have a red area around the tick bite. But what's different about this one is it'll continue to expand. So it's going to get wider and wider and wider if you don't have it treated, unlike a local reaction, which should go away after a few days. So if you get a rash like that, definitely you need to contact your doctor or us to consider treatment for Lyme disease. Some people talk about a bullseye or a target lesion. That can happen where you get like a little clearing in it, but not everybody gets that. So if you look up the rash online, you may see pictures of things that don't always happen. So any red area that's expanding a few days after, a couple weeks after tick bite should be evaluated. Testing for Lyme disease at this stage is not actually helpful because it takes a good month or more for the test to become positive, and you want to treat this rash, as soon as possible. The only time testing is helpful is if you don't get the rash or you didn't realize what the rash was, and now it's been at least a month since your tick bite. About 20% of people don't get the rash that I just discussed. So you may have symptoms later that are being considered as possibly related to Lyme disease, and then testing is important. So I know that was a lot of information. You can let me know if you have questions about that at the end. But let's go ahead and go to the next slide to talk again about avoiding, how to avoid ticks in the first place. So I think just about every slide we have says dress appropriately. And, that's really important in the summer. In this case, what we're talking about specifically is if you're going to be in an area that is likely to have ticks, places that are overgrown in particular, it's best if you can wear long pants, socks, tuck your pants into your socks if possible. Wearing insect repellent is also really helpful. So if you have bare skin, you can apply it to your bare skin or over the clothing itself. I didn't mention this when I was talking about sunscreen, but it's probably good to mention now that if you're using sunscreen and insect repellent, which we really should be doing if we're outside, put the sunscreen on first. And sunscreen really should have a chance to absorb at least 15 minutes, better 30 minutes before you go out in the sun, but also in this case, before you put on the insect repellent. So try to plan ahead, put on the sunscreen, let it absorb, then apply the insect repellent on top of that about 30 minutes later, and you're going to get the most benefit from that. So at home, in order to help prevent ticks, you can try to keep your grass short because they like living in taller grass, so that might help reduce your tick population at home. But regardless of where you are, it's important to really do these full body checks every day when we've been outside. If you're coming in, and you want to check right away, you can, but definitely by the end of the day to check all over for ticks. You might need to put on your readers. I know I do. Ticks are so tiny, to really look at all of the skin folds and things for ticks, because getting them off within that first day will prevent disease. So now we're going to go to another polling question to introduce our last topic today. And so similarly, we're going to have you choose an image here. And in this case, let's talk about, or let's have you answer which plant you think is poisonous, because that's going to be our last topic, is about poisonous plants and the rashes they can cause and how to treat and prevent them. So go ahead and weigh in on that. Give you just a minute, and then we'll see where most people are there, just to break it up. Give me a chance to stop talking for a second. So great. Looks like most of you chose image 3. That is poison ivy, which is the one that we're probably the most familiar with. This leaves of 3 with the little notch in them. Poison oak also has 3 leaves. They look more like oak leaves, but there's 3 leaves as well. And then poison sumac also falls into this category, but it's not as common in our area and tends to live in like wet, kind of marshy areas. So we're not generally in contact with it as much in our day-to-day kind of activities over the summer. But let's go ahead to the next slide to talk a little bit more about about, poison ivy and other related rashes from poisonous plants. So before we talk about, treatment and all of that, I wanted to just mention that it's the leaves, the stems, and the roots of these plants that contain this oil that is what causes the reaction. So even in the winter months, or when the leaves aren't green, we can still be exposed to these poisonous plants if we're digging things up, doing some yard work and clearing things out. So it's not just this time of year, but certainly this time of year, it's more common because the plants really flourish in the warm weather. So it's the oily substance on the plant and the stems, roots, etc., that cause the reaction. So if you get this in contact with your skin and don't get it washed off within 30 minutes or so, you can break out in a rash from it. Not everybody does, but many, many people are sensitive to this oil. I wanted to point out that it doesn't actually spread. That's sort of a common misconception that people have, that the rash is contagious or can spread. That actually doesn't happen, but what can happen is that the oil can spread from one part of your body to the other, or from your clothing to your skin, or from the tools you're using to your skin. So it's important that we get everything cleaned off. But then once you've completely cleaned everything off and washed it completely off your skin, the rash won't continue to spread. But what it does do is break out in different areas of your body at different times. So it seems like it's spreading. So for instance, if you were in poison ivy, maybe a few days later, you break out with a few bumps in one location, and then a couple days later, you break out another location, etc. That can happen over a week or two. And the areas that break out first are the areas of your body that have the thinnest skin, and the areas that you had the most exposure, so the most amount of oil. And then later, thicker skin or parts that just got like a little bit of exposure may break out. So that hopefully helps you understand why you see these clusters. They're often clusters of red bumps and blisters, and they're extremely itchy. So if you have the rash, in order to treat the symptoms, if it's just very mild and in an isolated area, you can also use some of this hydrocortisone cream that I mentioned before, that's over the counter. It's a good thing to have in stock in the summer months. So that can be really helpful to manage your symptoms. But if it's more widespread, and especially if your symptoms are really severe, again, worth contacting us or another healthcare provider to discuss other treatments, because sometimes like an oral steroid is really helpful to alleviate these symptoms when they're more severe and more widespread. And generally you need to take it for a longer period of time than with other things, like 2 to 3 weeks, because this can really persist for a while. So getting back to the oil that I was talking about, you want to wash your body right away, but you want to make sure that you clean all the other equipment. So I think if we go to the next slide, it'll talk a little bit about the tips, and we can kind of tie that into it. So we talk about leaves of three, that's the common ones, poison ivy and poison oak. Trying to avoid those if you see them. Dressing appropriately, as I said, it's on every slide. In this case, you're obviously trying to protect the parts of your body that might be exposed. Wearing gloves in particular when you're doing yard work, having long sleeves, long pants if appropriate. What's important here was what I was starting to get to before, is that right after you've been outside and potentially exposed, you want to remove those clothes right away. Make sure they get washed, even like outer clothes that you might not typically wash, to get that oil off, because otherwise it'll stay there for a long time. And the next time you wear a jacket or something, it's going to get back on you again. And then the garden equipment that you're using, you also need to clean that. If you can't wash it with soap and water, rubbing alcohol does a really good job too of getting the oil off. And then of course, washing your body, taking a shower as soon as possible, washing your hands to prevent you from spreading the oil from one part of the body to the other. As I mentioned, you usually have about 30 minutes, maybe a little longer, to get the oil off before getting a reaction. But this is another reason to consider something like barrier creams. If you're going to be in the with bare skin, you could try that because that'll give you a little longer to wash it off. You need to wash it off within 4 hours still if you use one of these barrier creams. And you need to put the cream on like right before you're going to be out, like within an hour of your exposure, a nice thick layer. But that would be something to consider if the clothing is going to be a little too hot for you on that day. So that was a quick run through of these 5 topics that we decided to try to cover today. And I think it brought us pretty close to the half hour. I knew it was going to be a little close this time, so I'm sorry if I talked too quickly. But if anybody has like just a question or two, we can certainly try to answer now. If you need to get off, I completely understand. And then if we can't get to all the questions, as Morgan mentioned, we'll get back to you. So hopefully they found a few tips in that quick run through. So I'll turn it back over to Morgan, see what we have.
Thanks, Dr. Glass. So I'm not seeing any questions right now, but as Dr. Glass mentioned, and as I mentioned in the beginning, you can find this video recording and any other summer health hazard tips on the website. And then sorry about that. And then if you do have any questions that we haven't gotten to today, or that you wanted to ask offline, we do have an email address here, triadinfo@r-health.md, that you can direct any questions to Dr. Glass and we will get those answered for you. But I'm still not seeing any questions. So thank you, Dr. Glass, so much for your time, and hope everyone else got some useful tips out of that.
Okay, great. Thanks so much for joining us today. I hope to talk with you soon.